Hey there, and welcome to this explainer. If you're tuning in, you're probably an athlete dealing with Osgood Schlatter disease, and honestly, you already know the frustration. That sharp, nagging pain right below your kneecap can feel like it's just completely dictating your entire season. But today, we're flipping the script. Consider this explainer your elite sports performance strategy. We're literally handing you the exact playbook you need to start running your own loading decisions, take back control of your rehab, and ultimately get back to the sports you love.
So picture this. It's the core question every single athlete faces in the heat of the moment. You're out there in the middle of a drill, you plant your foot, and boom, there it is. That familiar, totally annoying ache at the front of your knee. Instantly, panic sets in, right? Do you push through? Do you hit the bench? Do you just ice it and hope for the best? Well, today, we're going to shift you completely away from panicking over that discomfort. Instead, you're going to learn how to act logically, just like an elite athlete who is firmly in the driver's seat of their own recovery.
Okay, let's dive into this. The solution to all that in-game panic is something we call the 24-hour rule. Think of this as the single, foundational tool you're going to use every single day for your entire rehab protocol. It's incredibly straightforward. We evaluate the pain at your tibial tubercle, that little bump right below your kneecap, the morning after a loading session. That specific morning after signal is exactly what dictates whether you advance your training, hold your current level, or back off entirely. All right, let's kick things off with Section 1, brain noise versus tissue reality.
To really understand why this rule is such a game changer, we have to separate how your knee feels in the middle of a sweaty workout from how the physical tissue actually responds once the dust settles. See, pain during exercise is basically just instantaneous nervous system noise. It's literally your brain's check engine light flashing because your motor cortex is flagging the effort. It doesn't necessarily mean you're causing actual damage. But pain the morning after, now that shows the true tissue response. Tendons and apophysi, they have a delayed response to mechanical load. So that morning after ache tells us about the real physical work happening inside, things like collagen repair, proteoglycan turnover, and bone remodeling at the apophyseal margin. We want to measure that actual tissue response, not just the momentary brain noise.
Moving right along to Section 2, the decision tree. Now, what's really interesting about this slide is how it introduces the specific 0 to 10 numeric rating scale, or NRS, decision matrix that we use every single morning.
Here's exactly how we turn that tissue science into a daily action plan. Your playbook is laid out in 3 clean tiers. First up, if your morning pain is a 2 out of 10 or less, and it's the same or lower than yesterday, you've got a green light. Continue your current dose. Second, if you wake up and it's a 3 out of 10 or it's gone up by a point or 2, you hold. You don't advance. You just keep the current dose for the next session and reassess. Finally, if you wake up with a 4 out of 10 or higher, or your pain jumped by 3 points or more, you drop 1 tier in your loading hierarchy and reassess. The logic here is absolutely bulletproof. The cost of holding a dose for 1 extra session is 0, but stubbornly pushing through a 4 out of 10, that can literally cause a 1 to 2 week setback.
I really want to pause on this number right here. 2. A 2 out of 10 is your maximum acceptable working threshold. And this is absolutely crucial to understand. 0 pain is not the goal of this rehab. Let me say that again. 0 pain is not the goal. Some discomfort during loading and mild tenderness the day after are completely expected and totally acceptable. If you're just sitting around waiting for 0 out of 10 before you do anything, you're going to lose the mechanical stimulus your tissue desperately needs to heal. So remember, 2 is the magic number.
Let's move into Section 3, tracking your trajectory. Think of this like an athlete analyzing game tape or looking at performance stats to predict their absolute best next move.
To make the 24-hour rule work, you need data. So this is your new morning routine, and it takes exactly 30 seconds. Step 1, wake up and press directly on your tibial tubercle. Step 2, rate that pain on a scale from 0 to 10. Step 3, log what you did yesterday. Was it a clinic visit, a game, a heavy practice? Write it down. And listen, you have to be brutally honest with yourself here. Underreporting the pain just because you want to rush back into the game, that backfires. It leads to premature progression and painful setbacks. But overreporting because you're scared slows down your progression unnecessarily. Honest accuracy is your best weapon.
And this brilliantly illustrates why we bother tracking this every day. As your care team, we aren't just staring at one isolated number. We care about the trajectory over weeks. A steady downward slope? Fantastic. A flat plateau at a 2 out of 10 is also great. It means you're adapting and ready to progress. But sudden, sharp spikes in your graph? Those are incredibly useful.
They pinpoint exactly which specific drill, game, or exercise is overloading your knee, so we can step in and fix it immediately. So please, bring this log to every single visit.
So the crucial point is this quote right here. Pain isn't damage, it's information. If you wake up with a 3 out of 10, it is not a catastrophe. You haven't torn anything. You haven't ruined your rehab progress. Your knee is simply giving you data, telling you to hold your current dose without panicking. You're safe. You just need to listen to what the data is telling you.
All right, let's head into Section 4, Rehab Myths to Avoid.
Let's rapidly knock down a few common traps that consistently derail other athletes trying to rush their return to sport. First myth: if you have a zero pain morning, that means continue your current plan. It does not mean skip 3 levels and go sprint. Progressions have to follow the phase plan. Second myth: your knee aphosis doesn't know the difference between a physical therapy clinic and gym class. Sport, PE, and your home exercises all count as one cumulative daily load. Lastly, and probably most importantly, if your pain hits a 4 out of 10, dropping a tier is always better than resting entirely. Full rest actually robs your tissue of the loading stimulus it needs to build capacity.
Finally, we have Section 5, Safety and Your Next Steps.
Okay, you know the rules, you know the myths. Now let's clearly define your hard safety threshold. If you hit a 4 out of 10, you naturally follow the rule and drop a tier. Easy enough. But if you've dropped that tier and your pain still stays at a 4 or higher for 7 consecutive days, stop. Wave the white flag. Do not adjust further on your own. Contact your PT immediately. This is the clear signal that your care team needs to intervene and tweak the overall strategy. Let's move to and see how this builds a much better relationship with your clinical team. You are completely empowered to individualize this playbook. At your next visit, ask Dr. Schlatter or your PT these specific questions. Ask them to show you exactly where to press to reliably find your tubercle every single morning. Ask them to define what a true flare feels like for you personally. Ask them how to log a sharp, quick pain versus a dull, lingering ache. And hey, ask if factors like your sleep or stress levels should be added to your daily log. The more specific the data, the faster you recover. So here is my final empowering challenge to you. Will you use your data tomorrow morning to make the right call? You're no longer guessing. You're no longer panicking when you feel a little ache. Take out your phone right now, set a daily recurring reminder for the exact moment you wake up, and commit to logging your number. You are the one running your own rehab, loading decisions now. Follow the 24-hour rule, trust your data, and let's get you back in the game safely.